All right. I just wanted to say hello. It's great to see everybody. I look forward to seeing everybody in person. I think there was a time in which we really didn't think that was going to happen, and so I'm thrilled that we're gonna be at camp next week. It's been a quick turnaround trying to make this happen, and so thank you all for your patience as we quickly try to put all of the details together. We have been working closely with Jean Lyons and also Mandy, who is our health assistant, and Mandy is our nurse. Sorry, excuse me. Mandy is our health consultant. I don't think she is on the meeting today, but Jean Lyons is our health consultant from Children's Hospital. And together with Mandy, they spend a lot of time going through all of our camper files, contacting families, looking for people who need for us to dispense medication, who have pre-existing medical conditions, really just trying to keep our campus as safe as possible and to make sure that we're providing the best possible care for the kids. And of course, this year is going to be interesting as we look at all of the COVID protocols, and we have a really, I think, good and safe plan in place that we're going to talk about a little bit later. And but for now, we're going to go ahead and get started just talking about the common chronic procedures, the first aid, and then we'll go into the COVID response, which I think is something that is on everybody's mind. And it's going to be probably still a fluid situation for a while as things change. I think the guidelines change every day. And so we're doing our best to really respond to them, learn as much as we can. And we're just gonna, really all work together to make sure that camp is as safe as it can be this summer. So, so anyway, I will go ahead and let Jean take it from here. And we have today day camp counselors. We also have quite a few specialty camp teachers. We have some of our vendor partners. And so it's great to see all of you. We'll try to answer as many questions as possible. If you do have a question, go ahead and put it in chat. And while Jean is speaking, I will try to monitor chat, and then we'll try our best to answer as many questions as possible today, and get you guys all of the information that you need, and kind of go from there. So go ahead, Jean.
All righty. Well, I do wear a mask when and I do social distance, but so you can hear me, I'm going to take it off. Thank you, everybody. We're so happy to have you on board with us and excited to have kids come back on campus. It'll be an interesting summer, and everything is just as new to Jenny and I as it probably is to you guys. So patience is going to be needed with all of us as we support our families and try and make sure kids are safe. So what we're going to be talking about today, we're going to start with common chronic conditions. Those of you who are veterans to the CA camp probably have already seen this some of this presentation, but a few things have changed with some of the common chronic illnesses and the way we treat them. And then I've added COVID information for you guys to have for your background knowledge. So I'm going to share my screen with you. Oh, shoot. Jenny, you're going to have to enable me to share my screen.
Okay, here I am.
Hi.
Okay, try that now.
Let's see.
You guys, I've been doing a lot of Zoom meetings. Is it something I can help you with?
Yeah, I'm trying to share my PowerPoint on my screen.
Is your PowerPoint, have you already put it up?
It was up, yeah.
Okay, yeah, that's weird. The share screen isn't working. It should pop up with a list of what they want you to share.
It just says share my screen.
Yeah, go ahead and hit that.
There.
And then you decide.
Is that it? Can you see it now?
There you go, yeah.
Wow, thank you. So all this is new to us, as I said. So what we're going to start with, just so you know, is we're going to be covering severe allergies, including anaphylaxis reactions and treatment, asthma, and the emergency treatment for that. Diabetes, we'll go over briefly. If we get any students registered with diabetes, we go over that more individually with you. Right now, we don't have anybody that I know of that's registered with diabetes, and then seizures as well.
And if I may, guys, one more thing, that if you guys, everybody who's not being spoken to, if we stop our video, you'll see more of the screen. We'll get our faces out of here.
Wise. So hopefully you'll understand and be more confident in identifying and responding to students or staff with any seizures, diabetes, asthma, severe allergies, and hopefully learn how to recognize sick kids and how to support the surveillance tracking systems we have in place. So severe allergies are usually your body's response to major allergens like insect bites, bee stings, foods such as peanuts, nuts, a lot of soy allergies, milk, eggs, fish, and shellfish are the biggies. Some people react poorly to medications and latex, which includes latex gloves and balloons. So in terms of the COVID response, I know we've ordered the non-latex gloves, which actually are getting harder and harder to come by. So severe allergic reactions usually start out with hives that spread all over your body, wheezing, sometimes difficulty swallowing or breathing, red in the face, a lot of flushing, swelling of the lips, face, neck and tongue, hands and feet, tingling, you get a really funny sensation in your throat and tongue, nausea, vomiting, and abdominal cramps. And this is one that is often missed. Sometimes actually people will start with the nausea and vomiting, and it's really severe vomiting. Signs of shock, extreme paleness, color. I'm gonna X out of here. Clammy skin, or in the very extreme cases, loss of consciousness, which all of these things would tend to tell you that you're leaning toward a big medical emergency and you better act quickly. These are the introductory reactions you would see before somebody's getting into an anaphylaxis state. Most kids, when they have a healthcare plan, it'll say give Benadryl. And if the signs continue to progress after a minute or two, you're going to end up giving the EpiPen and calling the parent and the EMS right away. So anaphylaxis is a severe, life-threatening allergic reaction. It can occur within seconds or minutes of exposure to something that someone's allergic to, such as a peanut or venom from a bee sting. So treatment is based on the individual care plan. Usually you give the Benadryl first, call 911, and as symptoms progress, you may have to administer the EpiPen. And I do have a few to show you online so that you can see what they look like and how you would administer them. You want to have the student lay down and stay calm. The more they're up, you want to keep the blood pumping slowly so it's spreading less over the body. You want to keep them from fainting and all that good stuff. Any questions about allergic reactions so far? Okay. So anybody that brings you an EpiPen or you find out that has an EpiPen should have an anaphylaxis care plan that you see in front of you. If you look at with the red arrow, it says that they are higher risk and may need a severe reaction, and it should list what the allergen is up there. Usually they'll say peanuts or shellfish, so forth. And you want to follow these steps pretty carefully. For severe symptoms, again, you want to have you're going to notice shortness of breath, tightening of the throat, severe drooling or difficulty swallowing. Their heart probably will start racing. You may notice a rash, hives, facial swelling, and feeling anxious is another quite common reaction. So you want to make sure you read it carefully for what the protocol is. And if we get one of these, I will be happy to go over it with you, or you can consult with Mandy as well. but just knowing the steps of what they need so that you're treating them appropriately and as quickly as possible. The outcome of these, it doesn't scare you till you see a really bad reaction, and their throat, when it starts closing, sometimes is irreparable even after you give the EpiPen, so you really need to pay attention. You do not need to have every single one of these symptoms. You need to have probably at least 2 is what they recommend to give the EpiPen. So you may notice that they're complaining it's hard to breathe and they have hives. That would be considered 2 symptoms, and they would probably need their EpiPen at that time. And always, if you give the EpiPen, you call 911. So you want to stay with the student always, call the parent or have somebody else call the parent. If you need to, if they become unresponsive and no heartbeat, you want to perform CPR and notify me, the school, Mandy, the health aide, and Jenny. The other thing you need to know about when you call 911 is to alert the main office or Jenny so that they can direct the ambulance to where it needs to go. CA is a really big campus and it can be really confusing. So we do not want to waste time sending them on a wild goose chase all over the campus. Some of the more mild symptoms is just an itchy mouth, maybe 1 or 2 hives, a little bit of nausea or discomfort. You give the Benadryl for that, call the parent, and if the symptoms continue, again, you're going to give that. Mild symptoms, again, you're going to treat with the Benadryl and call the parent. The thing is with our parents, they typically don't work very close to Jefferson, to Colorado Academy. So whoever's calling the parent should ask about how long they think their time's going to be. Should the ambulance arrive before the parent, the ambulance, the paramedics take over and run the situation. They typically do not transport kids unless they really feel they need it. But if they need it, they'll leave, and we'll have to help the parent locate where their child has been taken. And I always recommend that somebody from the program follow the ambulance if the parent's not available. So the best way to avoid or preventing an exposure to an allergen is to avoid it. So we really try and discourage sharing food or trading food. Examining all the food brought into the classroom, which I don't think you'll have too much trouble with this year unless kids bring their own lunches, but we don't even, classroom parties are discouraged anymore, and certainly home-baked goods are discouraged because they're not labeled with ingredients. Many times when you read the ingredient of a certain product, it'll say we can't guarantee this was not made or came in contact with an allergen such as peanuts. And even with shared packaging or shipping, sometimes things get cross-contaminated. So it's just best to have things brought in a packaged product. And then if a child has severe allergies, it's always encouraged for parents to provide the child's own food and snacks so that we can control what they're getting exposed to. There is a difference between a food allergy and a food intolerance. A food allergy is your body's abnormal immune response to a food protein, whereas a food intolerance is often called a non-allergic food hypersensitivity. It does not really involve the immune system and is more common than the diagnosis of food allergies. You might see people that have lactose intolerance, gluten intolerances. Most of those people do not have severe allergic reactions, but they do get very uncomfortable and need to take medications to remedy that. A lot of times parents will tell you right away that they have an allergy. In reality, it's just a food intolerance. And not to downplay it, but our treatment is a little bit different. Another thing to watch with kids that have food allergies is bullying. It's very common. When other students find out that a student has an allergy, they sometimes will capitalize on that and use that as a bully opportunity. Several studies found that approximately 1/3 of children with food allergies have reported being bullied, which includes teasing and because of eating at a special table or eating only certain foods, not being included in class treats, treats with foods, and I've heard even of other kids threatening to expose a child to what they think they're allergic to, which also creates a very fearful, anxiety-driven response from the student with an allergy. If you notice that happening, please, mitigate the behavior, but please let us know, let Jenny know. We have a lot of supports we can offer to try and mitigate those behaviors. So any questions about food allergies or any other kind of allergy? Okay. Asthma triggers. So asthma triggers can include, can occur from exercise, colds and illness, allergies such as seasonal allergies, pollens, grass, animal dander, molds and dust, weather changes, humidity, cold temperatures, sudden change in temperatures, irritants such as cigarette smoke, air pollution, dust, strong odors and perfumes, and emotions, stress, anxiety, excitement, and laughing can incite asthma triggers and difficulty breathing. So if a student with known asthma, early signs that they're starting to have some trouble breathing, you might notice their eyes are watering, they have a real stuffy or runny nose, itchy throat, funny feeling in the chest, feeling anxious. As they struggle to breathe, you might notice more severe symptoms of fatigue, headache, dark circles under their eyes, usually because they're coughing a lot and not sleeping very well, and changes in behavior. When you have a low oxygen in your body, you can get really agitated and belligerent. So first aid for asthma is for the student to stop activities. So if you're out walking around or running on campus, and you notice that somebody's coughing a lot or struggling to breathe, like take a pause and have them sit and relax. Warm sips of water are very, very helpful. It tends to relax the chest wall muscles and reduce swelling in the lung tissues so that they can breathe a little bit better. Try and calm them, reassure them. If they relax, things will get better. And if they have an asthma action plan and medications, we'll follow that and administer their albuterol inhaler, which will help open up their lung spaces. Keep in mind, parents don't always have to tell us that their child has a medical issue. Sometimes they don't think it's significant. There's just a lot of reasons they may be afraid their child won't be included in a particular program, or they frankly can't afford the medication. So if those things are happening, please let me know and I'll try and work with the family to see what we can do to support them. But again, they don't have to share any medical information with us. For those that do, if they report that their child has asthma and needs medication at school, this is what the Colorado Asthma Care Plan looks like, the standardized one. And this is what most care providers use, but not all. The really nice thing about it is it kind of walks you through the steps. If you notice in this top section here, right above that blue arrow, we'll read this carefully. And some kids that have exercise-induced asthma, the care provider will recommend that they get pre-treated before strenuous activity. So there's 3 boxes: not required, routine, or student parent request. So routine would be if they really do have really strong exercise-induced asthma, they're going to want them to have it before PE, before recess, and or every 4 hours. So if they have PE at 11 and recess at 12, they probably only need it once. So we'll help you work with that as it happens. The other nice thing about it is it's broken up into breathing zones. So green is no symptoms and really is only recommending the pre-treat. The yellow zone is trouble breathing, some wheezing, frequent cough, complaining of mild tightness in their chest, not really wanting to do the activity, but talking in complete sentences. If they have a peak flow meter, which we don't see very often, they're within their parameter ranges. Again, if that happens, you want to have them stop their activity, give them their quick relief medication, and we'll go over that here too in a minute. So you're going to give 2 puffs, and you have them breathe in as they either they or you push down on the inhaler. Have them hold it for a second or two, release, do it again. And then you want to wait about 5 minutes and have them do 2 more puffs. You want to stay with that child until they're feeling better. Again, if they need it again, you do it in 15 minutes, give them the repeat the whole process. If they're still struggling to breathe, they're going to need more significant support, which may be including EMS support. Typically, though, after the first round, they feel better unless they're really a brittle asthmatic, and those are the questions that Mandy and I reach out to the parents to talk through. So if in the red zone, if they're coughing constantly, struggling to breathe, and you can tell, they'll be sucking in the skin around their clavicle and their ribs, really pulling up that chest. They really can't utter more than 1 or 2 words without becoming short of breath. Skin of their chest and neck, as I said, is pulling in. Their lips and fingernails may start to look a little blue-gray. They're not quite as coherent as they should be. You want to go ahead and give them their medication as we just went over, but you're going to be calling 911 to get EMS on site to help support them. Again, when EMS arrives, they have the ability to administer a lot more medications than we do to help keep that child safe. And if they feel that they're really going down the tubes, getting in trouble, they will transport them to the hospital. Always, always remember that when you're giving these medications to call the parent. Some students in Colorado are allowed to self-carry emergency medications, which include inhalers and EpiPens. We do not. It's available for almost any age student above the age of 6, but we really strongly discourage anybody under the age of 10 self-carrying a medication unless they can demonstrate that they're very responsible and they know how to use it. I always encourage families that are going to allow their child to self-carry a medication to keep a backup medication in the health office in case the child loses their medication. We always want to know where they're keeping it. Is it in their backpack? Is it in their cubby? Is it in their locker for older kids? It doesn't do as much good if it's in the mother's car. And monitoring them to make sure they're using it appropriately. If you see somebody using an inhaler every half hour, that's not appropriate unless they're really struggling, and then they should be going to the hospital. The same with EpiPens. Going back to the bullying, I've had kids threaten to use their EpiPen on other kids that are bullying them. So just being very aware and mindful of where their medications are being kept and how they're being utilized. Any questions about emergency meds for asthma and anaphylaxis?
Nope.
Okay, good. Diabetes. Diabetes is a chronic disease in which the body does not make or properly use insulin. Type 1 diabetes requires insulin. Type 2 may be controlled with diet or oral medications, but also might require insulin. Most, but not all, but most cases in the younger kids are type 1 related diabetes and do require insulin and insulin management in school. Some signs that you might see if a student is experiencing symptoms of diabetes or poorly treated diabetes are mild symptoms of low blood sugar, which is hypoglycemia. They might seem really hungry, shaky, a little weak, sometimes sleepy. Changes in their behavior. When they're low blood sugar, they tend to be very off task, difficulty paying attention, sometimes very agitated in more severe cases. You might notice they're kind of sweaty, feeling very anxious. Their pupils might look dilated, increased heart rate. As it progresses, lower. And so anything considered hypoglycemia is below their target range, which is usually 70 or below with the glucometer check. Moderate to severe symptoms would be confusion, extreme opposition, dazed appearances, extreme tiredness, inability to swallow, sudden crying, eventually some seizures and loss of consciousness. Again, if we have any students with known diabetes, we'd be going over this with you in more detail individually. But the truth is, sometimes kids can get into hypoglycemic issues even before they've been diagnosed or just simply from not eating well. So these are things to look for in kids if you notice that their behavior's off. Some things you could be considering just so that you're aware it's not normal and to call the parent. So first aid for hypoglycemia is a quick acting glucose. Usually it's 4 ounces of juice for kids that, or 3 to 4 glucose tablets if they have known diabetes. 4 to 6 hard small candies with sugar, so peppermint, Jolly Ranchers, that kind of thing. Cake gel and glucose gel are also good choices if they're really going low and you need to get it up quickly. The nice thing about the cake gel and the glucose is it slides inside the cheek and the mouth, so they don't really have to actively swallow it. It's absorbed through the mucous membranes of your mouth, as well as slowly swallowed through the back of your throat. After they start coming up, they're in their target range, you're going to end up following the quick-acting sugar with a form of protein or complex carb snack to keep the blood sugar from dropping again. It helps keep it more at a stable level. Treatment of a low involves several steps, so make sure it will take longer than 10 minutes. So when we receive students with diabetes, we have to be mindful of the resources required to support them, and that you guys are going to get the training you need if we do receive a child. But so far, we don't have any students with diabetes on our roster. Severe hypoglycemia can be a rare but life-threatening symptom. You want to place, if they're starting to lose consciousness, place them on their side. Make sure you have their healthcare plan handy and refer to it. Call 911 and the parent quickly. Don't ever attempt to give food or anything in the mouth if they're starting to lose consciousness. We don't want them to choke, and never leave the student alone. If you are in this situation, you've got your walkie-talkie, page Mandy or Jenny, and they'll get you some help. Don't ever hesitate to use that walkie-talkie, right, Jenny? So hyperglycemia is the opposite, it's high blood sugar. Symptoms somewhat are similar in the beginning: hunger, thirst, need to use the bathroom because they've been drinking a lot of water, often a headache and stomach ache. For kids with diabetes, you're going to want to allow them to have access to the water bottle and to the bathroom and a place to securely check their blood sugar should they need to. And that's the same for hypoglycemia. Again, we don't have anybody on the roster, but these are just symptoms I want you to be aware of just in general. Seizures, another big common chronic that we see a lot in kids, is a brief excessive discharge of electrical activity in the brain that changes one or more of the following body functions: movement, sensation, behavior, and awareness. A generalized seizure, which we used to refer to grand mal seizure or tonic-clonic seizure, is a sudden, you may notice a sudden hoarse cry. They may fall with a loss of consciousness, convulsions where they're shaking, their body gets stiff. Shallow breathing and drooling may occur. Loss of bowel and bladder function. Sometimes their skin, nails, and lips may turn blue. It usually lasts 1 to 3 minutes, and when they start to come out of it, they're going to appear very confused, have a headache, be very tired, sore, and their speech may sound a little bit slurred. First aid for generalized seizure: if it's a student with a known seizure, we want to refer to the healthcare plan. Stay calm because it's very scary, and you want to start timing the seizure. You want to make sure, see if they have if you do not know that they had a seizure, you might want to be aware, do they have a identifying bracelet or necklace that says they have a seizure disorder? In any case, you want to protect the student from any possible hazards, sharp objects. If they're in a chair, guide them to the floor. Once they're on the floor, try and remove any dangerous objects away from their body so that they don't sustain another injury. You want to turn the student on their side to prevent choking. Cushion their head because they're probably going to be flailing a lot. So a jacket, pillow, blanket, anything you could put under them would be good. Never put anything in their mouth. That's an old treatment that doesn't work. After the seizure, remain with the student until they're aware of their surroundings and are feeling better. Provide emotional support. When this happens to kids, it's very unnerving to them, very embarrassing. And then we will have you document any seizure activity that occurred during that time. If it's not a known seizure, if this is a student that didn't have an ID bracelet, we did not have a care plan, nobody ever told us they had a seizure disorder, you'd be calling 911 because we don't know what caused that seizure. Any seizure lasting longer than 5 minutes is also considered a medical emergency, regardless of whether or not they have a healthcare plan. So we'll be calling 911 for that. Most kids that do have a seizure plan will have emergency medications that we would go over with you. But any seizure lasting longer than 5 minutes or unknown cause or unknown seizure history, we will be calling 911. Repeated seizures without regaining consciousness. So sometimes it will say in their care plan that they have absent seizures or repetitive grand mal seizures. But if they are lasting more often than is documented in the healthcare plan, then we will be calling 911 as well. A change in the seizure type and it's occurring on site, we will be calling 911. If the student is injured, has diabetes, or is pregnant, we will be calling 911. And if there's if normal breathing does not resume, we will be calling 911. So there are different kinds of seizures beside the grand mal. There's partial seizures, often begins with blank stares, impaired awareness or ability to respond, repetitive, purposeless or clumsy movements, aimless walking, nonsensical speech. Sometimes some kids are, at first, if you don't know they have this, sometimes it appears they're under the influence of an illegal substance. They may be combative if restrained. They may be confused, again, with drunkenness or drug abuse, aggressive behavior. If you notice any of these things and a parent has not reported these to us, let me know and I will reach out to the parent and let them know what we're seeing and see how that conversation goes, and then I would follow up with you guys. The other type of seizure is an absence seizure. It's brief staring spells, almost like daydreaming with a loss of concentration. Usually only lasts a few seconds and then they return to their previous activity. They're really hard to pinpoint, and many kids in these situations are considered off task or just disinterested. So always good to reach out to the parent or the school nurse to help discuss these considerations as well. So first aid. So for partial seizures, if they have an action plan, we'll follow that. Stay calm, reassure everybody, track the length of the seizure, don't restrain them, gently direct away any hazards, and don't expect the student to follow verbal instructions. So you're going to have to make sure you're maintaining their safety. Stay with the student until they feel alert and aware. For absence seizures, follow the action plan. Usually there's no first aid. They usually return to normal fairly quickly. But if you know the student has this and they're increasing in frequency, it's a good time to reach out to the parents. So this child might need to have another evaluation with their neurologist. So before we go on to COVID, I'm going to stop screen sharing so I can show you how to use an EpiPen and an inhaler. And other considerations about medication. So this is the more prominent EpiPen. You guys may have seen these. They're very expensive. There's usually 2 for kids. They're usually called EpiPen Juniors. If you need to give it, you take the cap off and you're going to put your thumb where the cap was or hold it like this, either way. And you're going to inject it right in the meaty part of the side of their thigh until you hear the click, and then you count to 5, and then you can release it. Okay? It's important to know that you can go through clothing. You can go right through jeans. Make sure if they have cargo shorts, they don't have a wad of keys or a cell phone there. It's best to hold it in a grasp like this instead of this way, because if you accidentally have it upside down, you're going to end up giving yourself the injection. And you count to 5 and then take it out. Somebody should be calling EMS right away. There is usually a rebound effect. The EpiPen will help them for about 20 minutes, and as it wears off, they may start having a reaction again. So they will need emergency medical treatment. Any questions about the primary EpiPen?
Hey, Jean, it was hard to see the demonstration for the people who haven't used an Epi before. Can you stand up and show us
Sure.
kind of what you're talking about? Thanks.
So you pull off the cap, hold it in your grasp, and I don't know if you can. And you're gonna just put it right in the meaty part of their thigh, right on the side like this. Keep in mind, they're probably not going to be holding very still, so it may take 2 people to get this done. You count to 5. When you push it in, you're going to hear a click. You hold it there to the count of 5, and then you pull it out. EMS should be on their way. As EMS, when they arrive, you can give them this, and they will take it and dispose of it for you.
I have a question. Where will the EpiPens be located in wherever we're going to be teaching the class? Will they be with the kids?
So usually we try and keep them with the kids, but because the training is a little amended this year, we're going to keep them in the health office. And if you have a student that has one of these and you've taken the medication administration class or have a certificate, I can delegate it to you. Okay, so we're going to do it on a case-by-case basis, right, Jenny, for now? Okay, any questions about the primary EpiPen? So there's another product on the market called an AviQ. It looks like this. I love it because it talks to you. So you pull it off.
This trainer contains no needle or drug. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
I think
This
that
trainer may be reused for training purposes. Replace the red safety guard and gray.
I think it's very helpful. It would be very calming for somebody that doesn't do this very often to kind of talk you through it and refocus you. They're actually less expensive, and we are starting to see more and more of these. Any questions about the AviQ? Same process. Make sure you call 911. This is what the typical albuterol inhaler looks like. There are a few others on the market. I haven't seen one, honestly, that in any of my practice, but there's one where you have to pull down the cap here. It drops the medicine down, and then you use it. But this one, you shake it. You always prime it before they use it to make sure they're getting the full dose. And by priming it, you're going to shake it and just push down on it like that. And then when the child gets ready to use it, you want to put it about a finger length or so outside of their mouth. Have them open, and as you push down, you want to have them take a deep breath and hold it to about the count of 5, and then they can release. Wait a minute, and then have them do it again. Okay. Younger kids will also usually come with a spacer that looks like this. They put their mouth on this end and have them, and then as they do that, you push in here and have them breathe real slowly in and out to about the count of 5 or 10, and then repeat it again. Okay? Any questions about an inhaler? Okay. Do you guys want to take a stretch break before we go on to COVID? Jenny, do you have any questions?
I don't think so. Why don't we take maybe a 5-minute break and then we'll resume?
Resume? Resume to Zoom. Okay, I'll see you back at about 2:50.
Hey, Jean and Jenny, can I ask a question before we get started?
Sure.
Would it be possible for people to always mute themselves? Because when you're doing this, Jean, if somebody talks, they take your place. So if everybody's muted, and then if you turn off your video, it takes all of the video off the sides that we're seeing so I can see more of what you're showing us. Because I'm missing half of it with the people on there. And the way you do that is you can go down to your lower left hand screen, or you can go to the top of your independent screen and you'll see 3 dots and it'll give you all of that, all of those options. Thank you.
So is everybody back on, Jenny?
It looks like it. Yeah, I don't have anybody in the waiting room. So let's go ahead and get started again.
Okay. So did everybody hear that request that you stay on mute and minimize your screens so everybody can see what's being shared?
You basically hit stop video. It doesn't take you out of the meeting, but it stops your video from showing up on the screen so that everybody can see the PowerPoint that you've got.
Okay. Okay. Does everybody understand that? Any questions? Okay. Before we move on to COVID, I just wanted to talk a little bit more about medications. This is a very unusual year for us for processing forms, accepting registrations. So there may be campers that show up with medications that we didn't know about. So please, if that happens, notify Mandy or Jenny and they will collect them from you so that we can review them and make sure that they are appropriate to be administered at school. There's things that we have to review. We have to make sure that the medication matches the order. The label has to match the order. It has to have their name on it. It has to have a care provider's signature on the order. So we just need to make sure all that's in place. So please don't hesitate to let us know that if you receive medication so we can review it. Any questions? Okay, let's see. Okay, COVID. I don't want to bore you too much, but I wanted to start with the basics. It's a virus, a respiratory illness that can spread from person to person. It's causing the COVID-19, a novel coronavirus that was first identified in the Wuhan, China outbreak. It spreads mainly between people who are close contact with one another, about 6 feet, usually longer than 10 minutes, by sharing respiratory droplets produced when an infected person coughs or sneezes. It may be possible to get COVID by touching a surface or object that has been contaminated with the virus and then touching your own mouth, nose, or eyes. So it's really important to keep your hands clean, minimize contact, and avoid touching your face, nose, or mouth. And I included the link there. If you haven't read about it, you're certainly welcome to go on. There's a lot of information and guidelines through the CDC website. So the symptoms of COVID are changing, but for now, it's cough, fever, chills, muscle pain and weakness, shortness of breath, and loss of taste or smell. So these are the primary symptoms. You don't have them all necessarily. You may only have one. You may have them all. You may have 2 or 3. They may range in severeness from mild to severe and usually appear 2 to 14 days after you've been exposed to the virus that causes COVID-19. So what we are projecting to see after the recent events going on in downtown Denver is some increase in cases, which I think is slowly happening. Hopefully they won't be as devastating as they have been in the past. Some things that we can do to protect yourself and the students that you're working with is to wear a cloth face mask covering that covers your nose and mouth when in public settings. And it's really important to make sure that it's covering your nose and mouth securely. And our challenge with kids is going to be to make sure they're wearing them appropriately. There is a difference between the cloth and the paper mask. The cloth is heavier and it seems to be easier to wear for longer periods of time because the moisture in your respirations is captured in the cloth and doesn't deteriorate the paper of the mask. Again, you want to practice social distancing. Wash your hands with soap and water for at least 20 seconds or use alcohol-based sanitizer that contains at least 60% alcohol. We do plan to have various hand washing stations in other places besides inside the buildings where the sinks are located. For the older kids, we can use hand sanitizer more frequently. For younger kids, we may resort to having to use it occasionally, but we have to be very careful that they don't lick their hands. That's a lot of alcohol for them to be exposed to. On top of the hand washing, we want to make sure we clean and disinfect frequently touched surfaces. So desktops, shared crayons, if we're going to be doing any of that, sports equipment, that kind of thing. We're going to have to be very careful and mindful about how it's shared, how it's cleaned, and limiting what we do share is the best way to go about it. Right now, there's no current vaccine to protect against COVID. The best way to protect yourself is to avoid being exposed to the virus from the get-go. To prevent the spread of a virus, the best thing you can do is stay home if you're sick and get medical care if needed. You want to avoid public transportation, ride sharing, or taxis. Separate yourself from other people or pets if you're symptomatic, even in your own home. You want to separate yourself from your family members to the greatest extent possible. There's no specific treatment for COVID, but you can seek medical care to help relieve your symptoms. And it's a good idea to reach out to your care provider or have your students reach out to their care providers if they're symptomatic, so they can guide them about testing protocols and help them stay on top of their symptoms. If you need medical attention, please contact your care provider before you go in. Many times they have special appointments to avoid the spread within their office. Many care providers are providing telehealth services where they will talk to you on the phone and provide you with what you need telemedicine-wise. Know your risk of the illness. Everyone is at risk for getting COVID, but people that are older in age, above 65 is one of the critical markers, or anyone with an underlying medical condition may be at higher risk for more severe illness and severe outcomes related to the disease. So for camp, what we're going to be doing is doing staff screenings, which is the protocol recommended through all the public health departments, the CDC, the CDPHE, which is Colorado Department of Public Health and Environment, and all of the local and county health departments. So for businesses and our camp purposes, you're going to be following the staff screening procedure that Jenny will talk to you about. If you have symptoms of illness, you're encouraged to stay home and notify your supervisor as soon as possible so that a substitute can be provided in your place. And please be honest about reporting possible symptoms so that we may implement appropriate surveillance and reporting procedures to keep us all safe and healthy. So if you indicate on your screen that you've got a sore throat and a fever or cough and fever or any of the symptoms we talked about, you can expect a phone call probably from me encouraging you to seek medical attention, but really talking to you about, do you know of anybody you've been in contact with that may have had it or presumptively has it? Not everybody's getting tested, so your doctor may say, yes, you likely have it. You have presumptive symptoms, and in which case we have to treat it as though it's a positive and report it to the public health department. Not using your name, please understand that. We're just going to report the cases so they can direct us on what next steps we have to do to keep our students and staff healthy. The same will be going for the camper screenings. So there will be an app screening process the parents will complete prior to their student arriving on campus. They verify the symptoms. If they have symptoms, they should not get out of the car. They need to be sent home immediately. We will also be doing temperature screenings for students as they get out of the car, and anybody with a temperature of 100.4 or greater will also be asked not to stay. They'll have to leave immediately. And then campers that become ill during the day will be escorted to the health office as soon as possible after notifying the health assistant, which is Mandy, and we'll talk about that in a second and the reasons for that. Any questions so far? Okay. Daily illness surveillance tracking. Again, any staff or campers will be tracked with absentee information. So if you're sick and you call in sick, or campers, parents report that they're not going to be there because they're ill, I will be following up with them to do the surveillance tracking and required reporting to the health department. And then we will follow their guidance for next steps for disinfecting the school and whether or not we need to close. And I'll be coordinating that through Jenny. Again, I'll coordinate with that with Jenny, and she will provide any required communication that will be going home to parents regarding any closures or next steps. Or sometimes the health department will send us a form letter that says we've had one reported case, not to worry, or whatever. But honestly, these are the same reporting guidelines that we would use for measles or chickenpox. This is just a much larger scale than we've ever had to deal with before. So the other thing to keep in mind is confidentiality. And you may know that we have a case, but we will not be releasing any student information. Please don't post anything on social media. If you are approached by any immediate person that may be trying to get on campus or stops you on campus, please don't divulge any information and refer them to Jenny. Right, Jenny?
Correct.
Okay. So staff or child reporting illnesses during the day. So you have a student that isn't feeling well. You're going to learn to watch for signs if they're really flushed, if they have bags under their eyes, they're just acting really lethargic, complaining they don't feel well. You're going to have to notify Mandy or who is ever covering the health office before you take them there. She's relocated her health office. Forgive me, Jenny. It's in which hall? She's in the music building, is that right?
She's in the music building. It's Shotter's building. It's kind of in the center of campus. And for the day camp counselors, we're going to take a tour tomorrow when we're on campus, and we can point out where that building is located and where that office is located. If you are a specialty camp teacher and you have not been to campus or you work for a vendor, I'm going to send out a map. And I will point out where we're doing our drop-off and pickup, where the health office is located, in other important buildings. And then if you want to follow up or meet us on campus just to see it in person, we can do that as well, because it's important that we know where especially the health office is located.
So as we talked about earlier, for now, she's going to have all the emergency meds there, and she's really quick at responding. The other reason we moved it over there is because there's more space, and we need a space to isolate a student that has symptoms of illness. So there is a room across the hall from where she's going to have her primary health office that still allows for her to have line of sight supervision of anybody that's in there. So that's why we'd like you to give her a call, even if you're just on your way over, so she can make sure that room is ready to go. And that she clears out any other students that might be in there that don't need to be in there for getting Band-Aids or whatever, because we want to minimize any contact as we can. So once you've arranged it with her, somebody will escort the student to the health office. And then Mandy will notify the parent and complete the symptom track information and provide it to me so I can start the surveillance tracking information and find out more information from the family about what's going on with their illness. Again, it's a similar process. Once we get to that point, we need to determine if this is a presumptive case, if they've been in contact with anybody that may be positive or suspected positive. Some of the parents we serve may be first responders and may be at a little bit higher risk. We don't know for communicable disease. So these are reasons we're going to be tracking it very carefully so that we can do due diligence to make sure we're keeping our staff and our students as safe as possible. Any questions about that? Jenny, do you have any questions?
I do not.
Okay.
I think that the important message is that if you're not feeling well, don't come to work. I think those days when we would just sort of show up and push through it are over. We really can't do that. And so it's important to just make sure that we are taking care of ourselves and we're listening to our bodies and our symptoms, and not just brushing it off as allergies or something that we don't necessarily recognize. We just can't take that chance. And so we have a Google form that we will send out to you, and would like for you to kind of self-report every day if there are any symptoms, or if you don't have any symptoms. But if you have a temperature of over 100.4, we need to know about it. If you're feeling any of those symptoms that Jeannie discussed, we need to know about it, and we need to fill out that form every single day before you come to work. And that means taking your temperature every morning. If you don't have a thermometer, we will have a kind of temperature taking station on campus, and I will point that out in our day camp orientation on campus tomorrow. And if you're a specialty camp teacher or a vendor, then I will point that out on the map. And that's an area where you can come in and you can take your temperature and then, disinfect the thermometer and then kind of self-report with that Google form, just so we have that data, that information every single day. And I will, at the end of this, share my cell phone number with you, so that if you're not feeling well, you can text me, you can call me, just so we can arrange a sub for you. And if you're an employee of CA, I will share some information on paid sick leave and FMLA and some other important details for you. But we just need to really take this seriously and stay as healthy as possible. And I wanted to just share a little more information too about the parent drop-off. The parents are not going to get out of their cars. It'll be a curbside drop-off and pickup. We will have an app with which they can sort of self-report any symptoms as well. And then we will take camper temperatures, and then we'll hand wash and then get kids going for the day. We will have more hand washing stations on campus. We'll have more bathrooms. We've ordered some porta potties. That campers are not allowed to combine groups, and so they're going to be with the same group the entire day. Either they're in the full day camp, a full day specialty camp, or just a half day. They're in the past, as many of you know, they've been allowed to do a half day specialty camp and a half day specialty camp in the afternoon to create a full day, and that's not something that they're able to do. So the campers will have to wear masks, staff as well. It's going to be tough for the kids to wear masks all day. It's going to be hot. We're anticipating it's going to be a struggle. And I think that if we are outside and safely physically distanced, we can let them have some mask breaks, and we can kind of talk about that. It's going to be really difficult for them to wear them all day. And so we'll kind of see how that goes. But we're asking campers to come to camp with 2 masks. I think that's a good idea for staff as well. And we'll just kind of work together on that. But I think that if they are physically distanced outside, we can take some mask breaks. And I think that's going to be important for getting kids through this.
I would also encourage you guys to have an extra change of clothes, perhaps in your car, in case you are comforting a child that maybe got hurt or is afraid of something, is crying, and you get a lot of tears on your shirt, or they vomit, or we really need to have you change your clothes. Campers should also be encouraged to have an extra change of clothes with them for the very same reasons. Disinfecting wipes, they'll be available, Jenny, is that right?
They will be available everywhere. Yep. And I think at each new transition, we're going to ask for you to help us with this. They will be available in every room, and we just need to wipe down surfaces. We need to kind of clean our areas throughout the day. We will have housekeeping here cleaning the shared areas where we're all using. But if we're using a classroom, before we move on to the next transition, we need to wipe down those surfaces just to make sure we're keeping the campus as clean as possible. And we discussed the possibility of having kids help us with that. It's tricky because then the kids have to put gloves on, and we're just not sure that they'll be able to do it effectively. And I think that we typically, as educators, like to teach kids how to clean and help us out with those responsibilities. This is not the year for that. I think this year we just need to try to clean and be as effective as possible. And so if we could, again, really ask for your help to put on some gloves, take some wipes, clean down those surfaces, and then also just kind of, help kids to really make sure that they're hand washing for 20 seconds, that that they are, kind of not touching their faces and really wearing their masks correctly. We would appreciate it. But yes, so there will be a lot of wipes all over campus.
I would encourage you on the first day to do the hand washing, reminding them of the way to do it, making sure they're scrubbing all surfaces of their hand, doing it for 20 minutes. If you have some fun music other than Happy Birthday, that's a good way to do it. If you know the song lasts at least 20 seconds, maybe that can be your group theme song. Making it fun. This doesn't have to be punitive. Wearing masks too. We have to be careful that we're not too punitive about it, but they should be wearing them to the greatest extent possible so they're not spreading germs that way as well. Any questions? Okay. That's really, I was going to go down to, we're not going to be doing field trips. Then I'm here, the nurse consultant is here to help you for any potentially life-threatening conditions. We'll be collaborating, any neurological disorders, students with special health considerations, administering medications. But really, I think this year our focus is going to be on infection control. So anything I can do to support you on that, please let me know. Things that you think we could do better, we'd like to know, or areas that you think need greater attention, we're happy to review, because this is just all growing so quickly, and the advice and the recommendations are changing sometimes every 4 hours. So Jenny and I are both trying to stay on top of everything. And I guess I just really want to reiterate the confidentiality issues. We are bound by FERPA and HIPAA on the medical side. So healthcare plans, student health information, even contacts for infectious disease are kept confidential. So please be mindful of that and be careful of social media. It's our worst enemy sometimes in the education arena. Any other questions? Communication is important. If there's any communications that the parents want to address toward the nurse consultant, please direct them to Mandy or Jenny and they can get in contact with me easily. Mandy runs a wonderful, I've been doing this for 25 years and she's the best health office assistant I've ever worked with. So she's a wonderful resource, but she's only one. So we really rely on you to support the health of our kids as well. Any questions in the chat, Jenny?
No, actually, you know what? I take that back. There's one that I just saw. One person had asked about lunch, and lunch is going to be sack lunches this year, and we are not going to open our cafeteria. It'll be a picnic style lunch. We'll eat outside unless we have inclement weather, and then we have to move inside to our indoor locations. But we're going to eat our lunches, our sack lunches, and physically distance, and it's just going to be very simple this year. If you are a special ed camp teacher and you're teaching just a half day, if you could just bring a lunch for yourself, you're not going to be responsible for monitoring the camper lunches as we have in the past if you're teaching a half day. So just to go ahead and take care of the lunch for yourself. But if it is a full day camp, like the day camp or some of the specialty full day camps, then we will have a counselor that will go to, from each group, that will go to the one of the doors in the cafeteria building and pick up the box of lunches and then take them to the group. And we'll just ask your help to make sure the kids are physically distanced and then cleaning up after themselves. But we felt like that was the safest policy for this year. It looks like maybe there are a couple other questions in chat. Let me take a look real quickly. And I also wanted to mention that I included my cell phone number in chat, if everybody could jot that down. I will also send it to you in an email with some other information like the map and some additional training information that I want to share. If you're a day camp counselor, we'll talk about that in more detail tomorrow as well, because you might not necessarily just report to or text me. There are other people in your group that you'll probably want to inform if you're not feeling well. Let's see. If you, are teaching a full day program, then we will have a sack lunch for you if you're a full day teacher. If you are a teacher and you're working full day, but it's 2 half-day programs, the question was, are you responsible for any lunch activities? No, you are not. And so you can have that break from 12 to 12:30 during lunch, and do not have to supervise kids during that time. Another question, will we be notified if a student has a nut allergy? Yes, absolutely. This will be shared in the rosters that we will send to you. And Jeannie, we're not going to do the morning meeting in the way that we have in the past, right? We're just going
Correct.
to share the roster that has very detailed medical information. And so we will leave it up to you to really spend some time looking at those rosters and getting to know your kids, because there's often more information than just health information. There's behavioral information. Parents share a lot of information in the sign-up process, and it's really important that we know as much as we can about these kids. And so please take some time to look through that. If they have a nut allergy, if they have anything else, and then contact us if you need more clarification, if you need additional information. And please do that, well in advance. Kim will send the specialty camp rosters out typically, I think, Monday or Tuesday the week before. Tuesday, she's saying. And so that should give you hopefully plenty of time to review the roster, and then, check with us if you have any information. And then for day camp, we'll talk about that tomorrow, but we'll make sure that you have plenty of time to review that. But please don't wait until the last minute. Please don't wait until, the morning of the camp to be looking through that. We work pretty hard to get it to you in advance, and like I said, there's a lot of good information that's shared in those reports.
And Kim does a great job of trying to make it really specific and clear to you guys. So please take the time to read it. It's a lot of work.
I have one question about, you said there was an in-person meeting tomorrow for teachers who have never seen the campus before. I was trying to figure out if that was something that I was supposed to have RSVP'd for, but I'm not quite sure if I saw that.
No, that's a good question. We've got a couple different programs. Our kind of traditional day camp program has an on-campus orientation tomorrow, and so that's what that is. In the past, we typically have held an on-campus specialty camp orientation, and we've done tours for specialty camp teachers. Of course, everything is just so different this year. However, if you are new to CA and you would like to stop by in the next couple of days, or if you're not teaching until later in the summer, if you want to set up a time, I think it's always best to know where you're going to be teaching, where the health office is. It's really intimidating, I think, to show up that morning and not really know where you're going, not know how to get to your classroom, and then, feel responsible for a bunch of kids that have a lot of questions. And our program is much less complex this year. We are going to have about 200 to 300 kids compared to typically around 600, 650. And so there are not as many transitions. And so this year is going to be, I think, a lot more straightforward than it has been in the past, but it's still a large campus. We've still got 94 acres. And it's, like I said, it's intimidating to show up and not be able to find your room and some of the important buildings. And so please contact me. I would love to take the time to show you around and have that in-person meeting and give you a little tour. And if you're not teaching next week, we have maybe a little more time, but if you are teaching next week, let's figure it out. I think that would be a great idea. And if you can't do that, like I said, I will send a map to you and try to send as detailed, as much detailed information as I can so that you know kind of where to park and where your classroom is and where the health office is. But if you can make it onto campus, that would be great.
Thanks so much.
Great, thank you. And Kim is saying that she's happy to help with that also. Okay, there was another question. Let's see, if you're working as a specialty camp assistant, you might be moving around to different camps. And so Hannah, I will follow up with you individually. Let's see, and I'm just looking to see if there were any other questions that came up. Let's see. There was a question about sign in and sign out, which is going to be different this year. Essentially what is going to happen is the parents are going to pull up along the North Road and they will text a phone number that will be displayed on a sign. They will then get a text message back with a form with which they will kind of self-report and answer questions about symptoms and temperature. And if they answer no to all of the questions, meaning they do not have, their child does not have any symptoms and it does not have a temperature over 100.4, then their phone will generate a QR code, and the counselors are going to look at that phone, and if there's a QR code, that means that the camper can get out of the car. If the phone displays a yellow X, then that means that they have maybe answered yes to one of the symptoms, and then they are going to need to get back into the car and go home, and we will follow up with them. We're still kind of working out some of the details. I think we're going to really ask some of the day camp counselors, the traditional day camp counselors, to help us with that process. And we'll talk about that in more depth tomorrow. If you're a specialty camp teacher, we will hold a morning meeting. We'd like everybody to be here by 8 o'clock in the morning, just so we can make sure that if there's time, if you need to take your temperature, if there's if you need to find out where your classroom is located, and then we will kind of fill you in on the sign in, sign out process so that you have all of that information. And I'll share as much of it as I can in an email as well. But the nice thing is the parents are going to really just kind of pull up. We're going to check their phone. We'll have a system in place through which we will check temperatures and record that. And they're essentially going to just pull right up to your little area on the lawn and sign kids in with you. And we'll wash hands, and then we'll get you on your way so that you can get your camp started. And so I hope that answers the question. But like I said, we'll ask everybody to be here by 8 o'clock, at least on Monday, so that we can kind of fill you in a little bit on that. And I will share where that location is going to be in an email. And then, of course, if you have any questions, feel free to call me or email me or happy to schedule a tour with you. Let's see. I'm looking to see if there are any other questions that came up. Okay, that's a good question. If your camp is just in the afternoon, we will probably just have you check in with us in the office. And there are not many people that are just going to have an afternoon program. Jessica, I will follow up with you individually because we're still working out the logistics of the sign-in process with the afternoon programs. So I will get back to you on that one. Let's see. I would say that most people, there was another question that came in asking about the kind of ending time in the afternoon. We're typically out of here by about 4 o'clock. Let's see. Okay. I think that's about it, unless are there any other questions? Anything else that you'd like to know while we're here? Some of this is still a work in progress as we're reviewing the guidelines and trying to find the best way to put this all together to keep the campus as safe as possible. And so there will be more details to come. But I'm excited about it. I think families are really excited for the kids to socialize and be around other kids. I think that we probably want to anticipate that there are going to be kids that are going to struggle to be around other kids. I think some of those kids that have a little bit of social anxiety that haven't had that experience for the past 3 months, that could be a little bit difficult for some of them. I think it's hard to really know what to anticipate. This has been such a strange time, but I think we're just going to do our best to respond to the guidelines that continue to change every day, and we'll update you. But we're working with a much smaller group of kids this year. We've got a much simpler program. We're excited to be on campus, and I'm excited that you guys are joining us for it. And so please reach out if you have any questions, and we'll try to give you, as much information as we can. And then we'll work together just to troubleshoot how it's going to feel for kids wearing masks. This is the second day that I've had to wear a mask the entire day, and it's special. I mean, it did take some getting used to. But it'll all work out. I think it's I think a much better alternative than not being at camp. And so thank you guys for joining us on this kind of strange journey. But hold on just one second. There's one more question in the chat. Okay, perfect. Playground rules. We have decided not to open the playground. That might change, but at this time, we're not going to open the playground. If you feel like it's pretty important for your camp program to be able to use the playground from time to time, check in with me individually and we can talk about that. But at this time, we're going to just keep it closed. But there's a possibility that it might open later in the summer.
The other thing I wanted to add, Jenny, is we do have lots of extra equipment, some masks and so forth. If kids don't bring a mask, forget it, or lose it, we do have extra supplies of those.
Perfect. Yeah, thank you, Jeannie. Okay, anything else? All right. Well, thank you for your time today. I look forward to seeing all of you very soon, and have a great afternoon.
Thank you.
Thank you.
Thanks.
Thank you, Jenny.
Thanks, Jenny.
Thank you, Jenny.